respiratory infections to spread, and we do see a big drop in all kinds of seasonal infections normally across the summer months, and that's going to be a big help as we open up more to keep both traditional classic coronavirus strains but also these new variants which are exercising us very much at the moment at bay. But of course it's a worrying time because we are seeing these numbers climbing for this Indian variant, and what we want to know is, have the measures that have been put in place, the public health measures, surge testing, vaccination, enhanced rates of vaccination, enhanced testing, are they going to be sufficient to hold it in check? If they are, we're probably going to see the numbers turn the corner this week, and that will be the very encouraging sign that actually opening up yesterday was the right thing to do and that we're on course for June. Or if we still see them continuing to climb relentlessly, we'll know that perhaps we should reset our plans on what is going to happen in June and possibly look towards rowing back some of the May opening up even.
We think the next few days are going to be pretty important.
The new variant has been doubling its numbers roughly on a 7-day basis, and we can use that trajectory to gauge the rate at which the interventions are working or not working. We can also use the fact that because the number of cases across the country is now relatively small of all coronavirus cases, that means that there's a lot of sequencing capacity. So COG UK, which is the organisation which is a network of laboratories across the country that are reading the genetic codes of the people who test positive for coronavirus, hitherto they were testing about 10% of the samples. Because the numbers are now relatively low, they're testing 50-60% of the samples that are testing positive UK-wide. What that gives us is a very detailed picture of the tapestry or pattern of cases across the country, who is catching what, when, and what variant it is. And this enables us to keep tabs both on what the variants are doing and where they are, but also how the interventions are working, where they're being implemented, and that will tell us what does and what doesn't work, and at what sort of rate, what's proportionate, what's disproportionate, whether we have nipped this in the bud or whether we're going to have to think again.
Chris, for now, thank you. People have lots of questions for you. That number again, 0345 6060973. You can also text 84850. Just want to bring in our Westminster correspondent, Ben Kentish. After 5, we spent a great deal of time looking at the Indian variant and the measures that have and have not been taken to deal with it in this country. And Ben, you brought us the exclusive news from calculations you made about just how many direct flights from India have landed in the UK.
110 is the answer, and that is in 3.5 weeks alone since India was placed on the red list on the 23rd of April. Now, mostly when a country is placed on the red list, you might remember when South Africa was because of the variant there, when Brazil was because of the variant there. There is a ban on flights, direct flights from that country to the UK. Curiously, the government decided not to do that when it added India and also Bangladesh and Pakistan to the red list. You might wonder why, Eddie. I did ask the Department for Transport this. They say they have adapted and bolstered our world-leading test and quarantine systems, and they are effectively keeping under review whether a blanket ban would be necessary and proportionate. They say for now they will continue to closely monitor direct flights from a small number of red list countries, i.e. those from which flights are allowed. But then they say this, Eddie, public safety always comes first. However, we need to also consider other factors such as critical freight and helping British nationals return home safely. Now, when it comes to freight, what we're talking about here are only passenger flights. 110 are all passenger flights. On the issue of British nationals returning home, fair point. However, if you're a British national in South Africa, Brazil, or one of other 11 countries on the red list, you cannot get a direct flight home because they are banned. Now, you might say two things to this. Firstly, those people arriving will have to get a COVID test, of course, before they fly to the UK. That is true. However, we know from NHS data that 7% of people who are tested after arriving from India do test positive. Now, our figures suggest that could mean in the last 3.5 weeks alone, more than about 600 people arriving in the UK from India with COVID-19. We also know from the NHS that about half of those test positive. So you're looking at hundreds of cases of this potential new test positive for a variant. So of the 600, possibly 300 or so have got a worrying variant, likely to be the Indian variant. The second thing you can say to me is probably, well, these people have to quarantine in a hotel. Again, that is very, very true. That will mean, should mean, there is a reduction in onward transmission from those people. The concern is, as we've been hearing for days really, that the passenger passengers from red list countries mix pretty freely at airports, including busy queues for a few hours without social distancing at times, and there is concern about the possibility for transmission there, as there is with the airline staff who are operating these flights from India and then going on to work on other flights. Maybe you or I, if we go to Portugal, might have an air hostess who, not together, you and I might have an
We're no longer going. Is
I
that
thought
what
that was
you're
a
saying?
secret. Might have an air hostess who has
Way to find
12
out.
hours earlier been operating a direct flight from India. So there are concerns here. Labour saying to me it's an utter mess. We know they want a comprehensive hotel quarantine system. Well, I can tell you, Eddie, for now, the government's saying that the flight ban from India, or lack of one, will be kept under review.
Ben, thank you very much. Ben Kentish, our Westminster correspondent. Mohammed has a question for Chris Smith. Mohammed, welcome. What do you want to know?
Hi, thanks for taking my call. So my question is that if I'm doubly vaccinated, so I've had both my vaccines and everyone in my household has as well, is there any significant risk if I then mix with another household that's in a similar circumstance where they've all been doubly vaccinated as well?
Mohammed, hello. The answer is that we should take the greatest steps that we can, vaccine or no vaccine, to, at the moment, try and keep away from other people to the greatest extent possible, including when we meet indoors. The reason for this is that there are still people in the population who haven't been vaccinated, and no vaccine is perfect, so people who have been vaccinated could still catch the infection. So while we still have transmission going on in society, and until we get to a stage where everyone has been vaccinated, the guidance is that despite the fact we are getting together more indoors and in other sort of social contexts, there is still not zero risk, and therefore where possible and to the greatest extent where it's reasonable and practical, we should try and keep our distance. But again, it's down to what's reasonable, and if you've judged a low risk circumstance where your family are all vaccinated and they're all well, and you're meeting another group who are all vaccinated and they're all well, that's a really low risk circumstance. Whereas if you had a bunch of people who were unvaccinated, lots of pre-existing health conditions, or had been travelling and mixing with people who might be infected with something, and they got together, that's a very different risk assessment. So really it comes down to taking a bit of personal responsibility and thinking, what's the threat here, what's the risk, what have we done to mitigate it, and always take the path of kind of lowest risk and just do your best at every circumstance. And if most people do their best to do the right thing most of the time, we will go mostly in the right direction.
And what is your judgment, Mohammed? What do you think?
Yeah, I mean, I guess it's a sort of balance of risks, isn't it? So, I mean, I guess, you know, even if two households are completely vaccinated, I guess the children aren't. So that's, I guess, where the breakdown in that risk comes in, I guess. Yeah.
All right, good to hear from you, Mohammed. We appreciate it. Our number, if you want to ask a question of Dr. Chris Smith, 0345 6060 973. Here's the news now, 6:15. Thomas Watts.
Boris Johnson has told senior ministers he intends to proceed with the roadmap for lifting England's lockdown. More than 100 direct flights from India have landed in the UK since the country was placed on the travel red list. An excavation of part of a cafe in Gloucester will begin tomorrow in the search for a suspected victim of Fred West. The weather tonight, more rain in the south and far north, easing elsewhere, a low of 5 Celsius.
LBC Travel, I'm Joanne Webb. Delays on the M25 clockwise from junction 25 at the A10 to 26 at Waltham Abbey because a car has broken down. Slow still for about an hour on the A4 westbound from South Kensington to the Hogarth roundabout at Chiswick, and that's because of the roadworks near Sutton Court Lane. Very slow on Lower Thames Street eastbound all the way to Limehouse from Temple Station. It's slow for about 45 minutes, and these delays on the A12 continue as well, going northbound from Hackney Wick to the North Circular Road, and that's following an accident. In Whetstone, the A1000 Great North Road stays closed both ways after an accident, and on the trains, no services via Hemel Hempstead because of an ongoing investigation.
LPC. If your car gets written off, we'll help you stress less. Churchill Insurance will pay you up to £100 for immediate travel expenses. Like a taxi home. We take care of your claim. Yes. Churchill. Cars be underwritten for comprehensive cover only. Onward travel to one UK destination. Exclusive.
use the right test by looking at what the antibodies recognise, whether or not you've had the vaccine or potentially had the infection. Because if you have antibodies exclusively to the spike, then that shows you've been vaccinated. If you have antibodies to the nucleocapsid, that shows you have been infected. Of course, what it can't do is discriminate people that have been infected and vaccinated.
Thank you for the question, and the phone number 0345 6060 973. And Sarah is in Wembley. Hi, Sarah. What do you want to know?
Hi, Chris. I want to know, I have the second vaccine by in January of this year, I then had an antibody test, funnily enough, in around about March. Now, I've not had the virus, to my knowledge, and that antibody test came back negative for any sort of antibodies. But judging from the last question that was answered, does that mean that COVID test will stop? And also I wanted to ask, roughly how long would I be protected having been doubly vaccinated?
Hi, Sarah. The answer is that there are many interpretations of the result. One is that some people are contacting me because they say, I've had the course of vaccination and I went and got an antibody test, it was negative, now I'm worried. The reason this can happen is because if they do a test for the so-called nucleocapsid, the inner coat of the virus, but you've only had the vaccine, then it will be negative because the vaccine doesn't instruct your immune system how to recognise that inner part of the virus. So you will get a negative for that, but it doesn't mean you haven't made antibodies against the spike. So you have to be very careful when you go and get one of these antibody tests, which are not cheap, I'm sure you'll agree, but to make sure they can actually actively and accurately detect the spike antibodies and the same part of the spike that the vaccines are programmed to tell your immune system about, because it's possible you may also make antibodies against from the vaccine one part of the spike, but if their test looks for a different part, then it might not work. So you have to make sure that it is one that is judged to accurately detect antibody made against what your vaccine instructs the body to make antibodies against. That's one possibility. The other possibility is, Sarah, that the test went wrong, and no test is perfect. Sometimes these tests are flawed. And the other possibility is you are what is called a non-responder, and 5 to 10% of the time people don't make any response or don't make a detectable response against the virus. And that doesn't mean they're not protected though, and this is the confusion, because I've certainly had patients not with coronavirus but with other infections who have tested negative on our antibody test. We can prove they are immune to various things. So you could be in that situation as well. So I know that's not very reassuring for you because you quite like a black and white answer, and I can't give that, but I can give you the range of possibilities. You ask about duration of protection. Again, I don't have a time machine with me unfortunately this week. I'm working on that, but in the future I might do. Maybe I'll come back and give it to myself. But the answer to that question is we're doing the experiment as time ticks on, and we will find out in due course how long protection lasts for. But if it's anything like the protection we normally get to coronavirus infection, the answer is it's probably not that long-lived. Maybe a year, maybe 2 years, but maybe we're going to find this is the exception. But that's why the government are planning to give a booster round in the autumn to the people in the top 4 priority groups and the people who are clinically vulnerable for other reasons, just in case their immunity is well built by then.
Does that help you, Sarah?
Yes, it does. Thank you very
And by
much.
the way, where are you calling from? You sound like you're in an aviary.
Yeah, I was
No,
going to say.
I'm just outside my front door.
Are there lots of trees around?
Lovely.
Oh,
Yes, there are. Yes.
it sounds idyllic. Thank you, Sarah. Here's Vincent now in Bedford. Hi, Vincent. What do you want to know?
Are you going to do an emergency transfer with my toxicology? Things like that. 99% of the life is not going to play. So they're not going to stop that virus going through.
Yeah, Vincent, the answer is that this has not been covered in the current guidance, because although they do actually say that there will be no constraints on how people get together and mix, that doesn't say that there won't be rules about public health measures and protection measures out in public places, such as on public transport, for example. That door has been left open for tweaking. So I guess we're going to have to wait and see. To your point about whether or not masks do and don't work, you're right to point out that masks come in different shapes and sizes, and they do different things. The kinds of masks that are worn in hospital, which are very tight-fitting around the nose and mouth, they form an airtight seal and have a very, very high stringency filter in them. Those are designed to protect the wearer from anything that the people might give them. And when combined with eye protection, which is why people are wearing a visor with those masks, it blocks the so-called portal of entry for the virus getting into your eyes, nose or mouth. But when you're out and about, if you've got a respiratory infection and you're coughing, blowing out particles from your nose and mouth, if you put something in the way of that stuff coming out of you, you can cut down a bit the amount of material you deposit into the environment, and therefore you are helping to protect other people from yourselves a bit. But it isn't perfect, and you know, no defence is, apart from basically becoming a hermit, never meeting another human, and that's not possible either. So therefore it's kind of, everything makes a contribution, every little helps, in the words of one famous supermarket. So we're trying to do as much as we can most of the time to hopefully help that little bit, and therefore keep levels down.
Thanks, Vincent. Here's Raymond in Ainsford. Hi, Raymond.
Yeah, thank you, Chris. I understand the Indian variant has occurred in Australia, where there's virtually no trouble. What I'd like to know is it possible for a particular variant to undergo the same mutation with two separate countries independently of each other?
Raymond, it absolutely is possible, because the way in which these variants arise is that when the virus grows in a person, it is making genetic spelling mistakes when the virus copies its genetic material, and those genetic spelling mistakes are then inherited into all the progeny or offspring of that virus. Now, the thing that makes it very unlikely that the Indian variant has cropped up independently in India, and also the same pattern of changes has cropped up in Australia and in fact here in the UK, is that if it were just one or two genetic changes, because the virus has got 30,000 genetic letters in its genome, and it's got a probability of making a genetic spelling mistake in any of them, then that would be fine if it was just one or two changes. But this Indian variant has got between 13 and 17 changes in it, all in very specific places across the genetic code, and the chances of that arising independently in two different places simultaneously, so India breeds it and then the UK does it, Australia does it, France does it, very, very unlikely. In fact, you know, vanishingly unlikely. So it points to there being an origin, and that origin at the moment does appear to be somewhere in the Indian subcontinent, but then it has dispersed across the world because, of course, people go and move around, and when people move around, they take the germs with them.
A question now from Nikki in Enfield, who says, can you please ask Chris the following? I'm 50. I've just received my invite for the second jab. I felt ill for 4 days after the first jab with all the usual symptoms, plus an extremely heavy period which lasted for 2 weeks. I don't want to go through this all again. How can I convince myself to have the second jab when luckily my family and I have all escaped the COVID infection so far, and I feel as though we're past the worst? My husband has had both jabs and my children are young adults.
Well, obviously I can't say, because you can never say never or ever say ever in medicine, and for that reason I can't say that the second jab would be any better than the first. But what I can tell you is that most people are saying, well, they actually had more trivial side effects the second time, if they did get any. And of course you don't know for sure that what happened to you was a direct consequence of having that jab. I'm not belittling what you're saying, I'm just saying it's very easy when you're vaccinating millions of people at the same time that people then automatically will attach a significance to a coincidence, because that thing that you described happening, the heavy periods or the feeling awful, perhaps that was going to happen anyway, and you happen to have the vaccine around the same time, and to your mind one was connected to the other. It may well be, but on the other hand it may well not, and it's important that we monitor people using something called the yellow card system, which enables us to report side effects and follow up to sort of look for those sorts of associations. At the moment I'm not aware of there being direct connections between, say, heavy periods or some of the side effects that people are describing and the vaccine, but sometimes there are those connections because everyone is different. What I will say to you though is it probably won't happen with the second jab, and having the second jab is the best thing to do, because as the University of Oxford's own trial data has shown, catching coronavirus tends to be a great deal worse in terms of its risk of all the side effects and risk of feeling rotten compared to having the vaccine and any side effects that can give you.
Good luck, Nikki. Thank you, Chris. Dr. Chris Smith with us till 7. 0345 6060 973. The COVID report coming in a moment after the headlines from Thomas Watts.
Exclusive analysis for LBC has found more than 100 direct flights from India have arrived in the UK since the country was added to the travel red list. There are concerns the spread of the Indian variant of COVID-19 and could delay plans to lift lockdown measures. Dominic Cummings has blamed government secrecy for what he called a catastrophe in the pandemic response. Boris Johnson's former aide is due to give evidence to MPs next week over the handling of the outbreak. An emergency summit of EU foreign ministers is set to call for a ceasefire between Israel and Palestinian militants. The meeting follows the latest Israeli airstrikes on Gaza and further Hamas rocket fire from the territory. The weather tonight, further showers affecting southern England and northern Scotland, the rain largely dying out elsewhere. Foggy in places, a low of 5 Celsius.
Nick Ferrari at breakfast. Weekday mornings from 7, LBC. Why many of you are deciding not to have the vaccine, Richard in Nottingham.
They functioning immune system. So why should I take something I don't need? It's past the peak of the pandemic. Been doing yoga 21 years. I kept myself healthy.
Respectfully, I don't care if you're doing yoga as you're talking to me now.
Why can't I rely on my own immune system?
Because you don't have the right to use up NHS resources by simply refusing to have a jab that millions of others are clamouring to get, Richard. Nick Ferrari at breakfast. Weekday mornings from 7. Listen live on Global Player, LBC.
You can always trust a bit of stargazing to put a twinkle in your eye. So if you're on the lookout for someone to do that building renovation, complete with stargazing skylight, simply visit trustedtrader.com. There you'll find plenty of vetted, reviewed, reliable professionals in an abundance of trades. Like a builder who'll provide the star treatment. For trusted tradespeople, let the superstars align.
For many of us, future plans don't come much bigger than moving home. That's why at the Halifax, we want to make sure nothing gets in your way. So if you're unable to visit us in branch for a mortgage appointment face-to-face, we're more than happy to come to you. Every week, our colleagues are doing over 3,000 mortgage appointments by phone and video call, so we can keep your moving plans moving along. Halifax, it's a people thing.
I'm sorry. You have progressive memory loss.
When you hear these words, the outlook is bleak. But at Recognition Health, the brain and mind experts, we're working to change that. Volunteer for our clinical studies to receive free access to a new generation medication, as well as comprehensive medical screening. With your help, we can change the future of MCI and Alzheimer's disease.
You have progressive memory loss. But here's what we can do.
Go to brainandmindexperts.com.
Hi there, small business owner. Your tiny QuickBooks team here.
Just a quick reminder that we take care of calculating and filing your VAT and payroll taxes, which makes it easier for you to manage throughout the year.
That's right. You're not missing out on any tax savings.
Not on our watch.
For available tax products, visit quickbooks.co.uk. They say the more you put in, the more you get out. But while it's true of learning how to play the saxophone, it's not true of the all-new Hyundai i20. Advanced safety features, amazing connectivity, great new design, and it's a mild hybrid. And with additional savings at the Hyundai Hybrid event, this time when you put less in, you get more out. The all-new Hyundai i20, ready to impress. Offer ends 30th of June, saving against list price. T's and C's apply, guarantee may be required. Hyundai Finance.
Commuting into the office? Top up, tap in, go. Reconnecting with friends and family? Top up, tap in, go. Day tripping to the coast? Top up, tap in, go. With our improved Key Smart Card, loading, managing and using your tickets for travel has never been easier. To get yours, search Thameslink Key Smart Card. Thameslink, we're with you.
This is LBC with Eddie Mayer. Call 0345 6060 973. That's the number to fire a question at Dr. Chris Smith. Before 7, we'll bring you COVID